Bleeding gums. It's something many people notice when they brush or floss, but most don't think much of it. The truth is, bleeding gums aren't normal and they're often a warning sign of underlying issues with your oral health. So, why does this happen? And more importantly, what can you do about it? Let's break it down. The most common cause of bleeding gums is gingivitis, the earliest stage of gum disease. It happens when plaque, a sticky film of bacteria, builds up along the gum line. If it's not removed through regular brushing and flossing, it hardens into tartar, which irritates the gums and triggers inflammation. A study published in the Journal of Clinical Periodontology found that gingivitis affects nearly half of adults worldwide. The symptoms? Red, swollen gums that bleed easily when you brush or floss. At this stage, gingivitis is reversible, but only if you act quickly. If left untreated, gingivitis can progress into periodontitis, a much more serious form of gum disease. This is when bacteria begin breaking down the tissues and bone that hold your teeth in place. A landmark study in the Journal of Dental Research confirmed that periodontitis is one of the leading causes of tooth loss in adults. But the effects don't stop there. Research from the American Heart Association has linked gum disease to heart disease, diabetes, and even Alzheimer's. When bacteria from the mouth enter the bloodstream, they can contribute to inflammation throughout the body. That means bleeding gums could be an early warning sign of something much bigger. Now, while gum disease is the number one reason for bleeding gums, other factors can also play a role. One of the most common is brushing too hard. A study in the International Journal of Dental Hygiene found that using excessive force or a hard bristled toothbrush can actually wear down the gums and cause them to bleed, even if they're otherwise healthy. The solution? Switch to a soft bristled toothbrush and use gentle circular motions instead of scrubbing. Another major factor is vitamin deficiencies, specifically vitamin C and vitamin K. Research from the National Institutes of Health has shown that a deficiency in vitamin C, which plays a crucial role in gum health, can lead to increased bleeding and inflammation. Historically, this was the cause of scurvy, a disease that plagued sailors who lacked fresh fruits and vegetables. Today, while full blown scurvy is rare, low vitamin C levels can still contribute to gum problems. Similarly, vitamin K helps with blood clotting, so if you're not getting enough, your gums may bleed more easily. Certain medical conditions and medications can also make gums more prone to bleeding. Blood thinners like aspirin or warfarin, for example, reduce the blood's ability to clot, which can make even minor gum irritation result in bleeding. People with diabetes are also at higher risk, according to a study in the Journal of Periodontology. Diabetic patients are more likely to develop gum disease due to their body's reduced ability to fight infections. So, what can you do if your gums are bleeding? First, focus on your oral hygiene. Brush your teeth twice a day with a soft bristled toothbrush, floss daily to remove plaque between your teeth, and consider a natural antimicrobial rinse to help reduce harmful bacteria in your mouth. While many people turn to alcohol based mouthwashes, these can sometimes dry out the mouth and disrupt the balance of good bacteria. A more natural alternative, backed by research, is oil pulling with coconut oil. A study published in the Journal of Traditional and Complementary Medicine found that oil pulling can help reduce bacteria linked to gingivitis and bad breath, making it a gentle addition to an oral health routine. Second, get regular dental checkups. A professional cleaning can remove tartar buildup, something that brushing alone can't do. If your gums continue to bleed despite good oral care, it could be a sign of something more serious that needs professional attention. Third, pay attention to your diet. Make sure you're getting enough vitamin C from fruits and vegetables, and if you're on blood thinners or other medications, talk to your doctor about how they might be affecting your gums. Staying hydrated and eating a balanced diet can help support gum health naturally. The good news, if caught early, bleeding gums can usually be reversed with proper care, but if you ignore it, it can lead to serious health complications down the road. If your gums are bleeding, don't just brush it off. Take action now to protect your oral and overall health. If you found this helpful, Be sure to like, subscribe, and let us know in the comments if you have any questions. What's worked best for your gum health? Let's talk about it. Thanks for watching, and we'll see you next time.